Today, we are focusing on seizure disorders, where the NCLEX tests your ability to prioritize safety and airway management under extreme pressure. Imagine your patient suddenly loses consciousness, their body stiffens, and they begin to fall. This is the tonic phase of a generalized tonic-clonic seizure. Your immediate first priority action is not to call a code or grab medication. It is to protect the patient from injury. You must safely guide them to the floor. Move any nearby furniture and place a small cushion or your jacket under their head. A common exam trap will offer incorrect options, like restraining the patient's limbs or forcing a padded tongue blade into their mouth. Both of these actions are dangerous, can cause musculoskeletal or dental trauma, and are always wrong answers. Your primary role is to observe and protect. You need to note the exact time the seizure began and carefully observe the sequence of events, as this information is crucial for the medical team. As the patient transitions into the clonic phase, characterized by rhythmic jerking of the extremities, your focus must include the airway. The single most important intervention to protect the airway is to turn the patient onto their side into the recovery position. This simple maneuver prevents the tongue from occluding the airway and allows saliva to drain from the mouth, significantly reducing the risk of aspiration. After the seizure activity subsides, the patient enters the postictal phase. They will likely be exhausted, confused, and disoriented. Your nursing priorities are to perform a neurological assessment, check vital signs, maintain the side-lying position, and reassure the patient calmly as they reorient. Do not offer any food or drink until you have confirmed they are fully alert and their gag reflex is intact. The NCLEX will also test your knowledge of a critical emergency known as status epilepticus. This is defined as a seizure lasting longer than 5 minutes, or a series of seizures where the patient does not regain consciousness in between. This is a neurological emergency that can lead to permanent brain damage. The priority intervention is to secure IV access and administer a fast-acting benzodiazepine, such as IV lorazepam or diazepam, to stop the seizure. For long-term management, a medication frequently tested is phenytoin. You must know its therapeutic drug level, which is between 10 and 20 micrograms per milliliter. A key early sign of phenytoin toxicity that the exam will present is nystagmus, an involuntary twitching of the eyes. A classic long-term side effect is gingival hyperplasia, an overgrowth of the gums, which makes meticulous oral hygiene education a critical nursing responsibility. You must teach patients to never abruptly stop their anti-epileptic medication, as this is a primary trigger for seizures. To consolidate these key points for exam day, remember the phrase "safe side." Suction and airway equipment at the bedside. Floor clear and bed in the lowest position. Ensure IV access is patent for emergency medications and always turn the patient to the side. This simple phrase helps you remember how to prepare the environment and what your priority action is during an active seizure.